Hello and welcome to Cultivate the Moments. This is Adriana and I'm so excited to have a really amazing guest on today. So today I have Danny from Rec Therapy Today and we really discussed a lot. He is someone who pioneered a lot of the online continued education we do have and really goes into depth on what continued education is in the field of recreation therapy and how important it truly is, and really puts a beautiful analogy of it, of updating our system on our skills and competencies as professionals. Next, we go into the discussion of psychology and recreation therapy, because these two, as we mentioned in the discussion, don't really have a crossover, but instead are so in-depthly connected. So if you want to hear more and learn about it more, continue to tune in, and I hope you enjoy. Danny, it's such a pleasure to have you on. I am so excited to talk to you because really there's not a ton of men in the field of recreation therapy, and I love that not only are you in the field of recreation therapy, but you're such an advocate for the field and for continued education. So I welcome you and would love for you to introduce yourself.
Thanks so much for having me on this podcast. My name is Danny Pettry, and I operate the Rec Therapy Today website. It provides continuing education. I've been a rec therapist since 2002. And yeah, I love rec therapy. I've been in the field for a long time. I went on to get a master's in rec therapy from Indiana University as well.
Awesome. And what, if you don't mind me asking, really led to that passion of recreation therapy, and how did you find it?
Well, I just love reading and learning and helping people. Those are things that I'm really passionate about, so it fits really well into my life.
Awesome. Yeah, I really appreciate you sharing that. I can't wait to dive into this conversation and get to know you a little bit more and also learn from you. So to dive in, I'd love for you to explain what meaningful recreation and leisure look like to you.
My answer is fairly simple. It's doing what makes your heart sing, and that can be different for different people. It's really finding something that makes your life worth living. For me personally, I'm an introvert. My work requires a lot of extrovert activities, so I like alone time and quiet time during my own leisure.
Yeah, that's awesome. And I think personality has like such a big importance in what interests we do find and activities that we do like. Is there any specific activities that you really enjoy for your personal leisure or recreation?
Mostly attending quality time events with my family and going to the movie theater, and I read a lot of books and a lot of apps on the cell phone.
Yeah, for sure. That's very interesting. What's your favorite genre or category of books and reading?
Well, I mostly read self-improvement books, but to keep a well balance, I throw in a fiction book every 2 or 3 books.
Nice. That's awesome. Yeah, I'm like a self-help advocate. I love like bettering myself. In the last podcast, I really had a huge reflection point on, I need to also not always want to grow, but also be like happy with where I am. So it's definitely being a mix for me. So that's awesome. I really appreciate you sharing. So to get us started and to kind of build a foundation so that everyone understands what rec therapy today is, I'd really love for you to share how you started Rec Therapy Today and, why continued education is so important for yourself and for recreation therapists.
Okay, that's a great question.
Yeah.
It started out when I was really in undergraduate school. I was looking for a scholarship in rec therapy, and I Googled scholarships, and really I couldn't find any, but I did find the Peg Conley Scholarship, which allowed a student to attend the national conference through the American Therapeutic Recreation Association. And I didn't win it the 2 years I was in undergraduate school, but I did win that award in 2004 when I was a student at Indiana University. So this was still post 9/11. I felt a little uncomfortable about flying, so I decided to drive from my little town of Huntington, West Virginia, and it's on the same interstate. I took I-64 west all the way to Kansas City. It was just one road. I imagine it took me 12 hours of driving, and somewhere along that drive, I thought there must be a better way for people to earn these credits. I'll share that my program through Indiana University was a distant education program. I don't want to outdate myself, or I mean, I don't want to date myself, but in that time, they recorded the classes on VHS and mailed the VHS to us. So we watched it like 2 or 3 days later, and
Yeah.
then we participated in the discussion. And I suppose that also encouraged me. I thought, well, we could do, there's more technology. We can do online trainings. This was way before we had Zoom or anything like that. It might have even been before YouTube.
Probably.
So I created my first course in 2006, but my business really didn't start until 2007. And it's really grown since then.
That's very interesting, and I can imagine how much it's evolved, given technology and all that. So as recreation therapists, it's part of our competency to continue our education, and I'm wondering, why do you think this is an important competency that we need to have, and why do you think it's important?
I'm going to say that continuing education is a lot like technology. If you could imagine a computer and even imagine using a 1995 computer in today's world of technology, it probably wouldn't be able to do much. So if we could think of rec therapy, if the only education you have is from your degree, it could become outdated. There might be new research or new evidence that proves other things to be more effective. So it's just important to just keep getting updates.
Yes, I completely agree. Definitely updating our knowledge on the field. And it's interesting just in, since hearing about recreation therapy for myself over the last, I'd say, 4-ish years, um, over the last 4 years, how much it's changed even, and how much, different aspects of psychology are becoming more popular and stuff like that. And in a little bit here, we're going to dive into that crossover between psychology and rec therapy, which I'm really excited to talk about. So in TR, do you think there's specific areas that we can continue our education in?
Yes, I would say the best way to find those areas is to go to the National Council for Therapeutic Recreation Certification website, NCTRC, and they have resources that list job analysis areas and TR, therapeutic recreation knowledge areas. So continuing education in those areas are what they will accept and improve. Of course, I like to share for people to be open-minded that you could also take other types of continuing education, even if it's not approved, pre-approved or approved, just to grow and develop.
Mm-hmm. Yeah. Yeah, I'd love to hear, on your website, is there a specific aspect that you focus on? And is there one that you're really passionate about in continued education?
I work at a psychiatric hospital, so most of my courses are behavioral health focused. I also work with children and teenagers. So really, those are my main areas. I invite other people to present webinars from areas that I really don't have the competency to teach. I know at CTRS is a CTRS, but I'd almost feel incompetent if I'd start working in physical health and rehabilitation, just because I've been in mental health for the last 20 years. So I often get other people in those areas to fill in the gaps that I don't know.
Yeah, yeah, I love that. And I feel like even without our clients, but in our profession, we can pull from other strengths and abilities and really focus on that too. Awesome. So do you have any other thoughts on continued education that you'd like to share? Some things that you see recreation therapy going in the future with continued education?
That's a good question. I definitely believe more online continuing education. This year, ATRA has canceled their live session in Cleveland, which I felt very disappointed. I really wanted to go up to Cleveland. It's fairly close to where I'm at. However, sometimes things like that happen. I definitely recommend conferences because you get the networking opportunity that you just don't get when you do online courses. But it's nice to know that those courses are there for people as an alternative.
Yeah, for sure. It definitely makes it more accessible. You're not paying all those expenses to go to a different city. But yeah, I definitely miss the networking aspect. I feel like it's really big. And, even in amongst the conference, you may meet an individual and they may be at a similar facility and you may share ideas that you hadn't even thought of before. So that, micro networking and micro learning is just as important for sure. So you mentioned that psychology is really important to you, and I really love this. And I recently did my practicum at a forensic psychiatric unit, which was really, really interesting and honestly life-changing. So I'd love for you to share about the crossovers of recreation therapy and psychology.
My professor in graduate school is Dr. David Alston at Indiana University, and he said that his graduate professor referred to us in rec therapy as applied social psychologists. And social psychology has a lot to do with people and interpersonal relationships and how it impacts us. I can think of one study where they had a person racing on a track alone and they measured their time. And then they had two people race against each other. And the social psychology of having that competition, like in your peripheral vision, helped both people to run just slightly faster. So there's a lot of social psychology things that can really improve our performance. Most rec therapy interventions are group-based, so I think that's really important. I'll also share about positive psychology, which is really all about creating a life worth living, what brings you happiness, enjoyment, pleasure, meaning in life. So I also think we're applied positive psychologists as well as social psychologists.
Yeah, that's very interesting. I'd love for you to give some examples of what things you focus on in a psychiatric unit. I think this is something that, not all of us get the experience, but I think it's really important, and I think it's interesting to hear about.
With our acute care stay, the kids are only there for 6 or 7 days. So definitely providing some education on healthy things they can do when they get out of the facility. Those children suffer from suicidal thoughts or abuse and trauma and just all kinds of things. And a lot of them are very depressed. And I think providing any education on, finding what cheers you up, finding social support, people who can cheer you up, getting involved in activities as a healthy distraction. For example, if a person's like using alcohol or drugs or cutting themselves or anything harmful, just teach them healthier, more effective ways.
I was just going to say, yeah, I think that healthy coping strategies was something that we really focused on at the forensic psychiatric unit too. I think it's so big for sure. And go on, I'd love to hear more for sure.
I would describe rec therapy as this way. You can imagine counseling, and if you see two people talking behind a window, there's a therapeutic process going on, versus if you saw two people sitting at a Starbucks window, it's a different type of communication. So when people look in the window and see the recreation therapy group, they might think, oh, they're just passing a balloon around, or they're just coloring, or they're just playing a video game. However, we in rec therapy know that there's this greater therapeutic process going on, because we do have that discussion with the patients of, what are you learning? What are you gaining? How can you use this information to improve your life when you get out of care or out of the acute care program?
Yeah, and I know I took one of your courses on counseling skills, and I think this is something that other professions often overlook. Even I was chatting with my dad after I was in my practicum, and he was like, "Oh, I get why they call you like a recreation therapist." So I'd love for you to, highlight, some of those counseling skills that we do have, because I find that, in everyday interactions, if you can think of friends and family, when you're doing those activities, I find I'm more likely to share what's happening in my life. And I think as rec therapists, we have that as well.
A lot of the counseling skills really anyone can use. You don't have to be a counselor to use the skills, such as building rapport with the patient, the client, the kiddo is what I call them. Of course, keeping healthy boundaries that, you're still professional. You're not going to use the patient to meet your needs for any reason. It's kind of a one-way friendship with them. Effective listening, validating that they're real and their emotions are real. With survivors of trauma, they attribute having one person who is really there and really cared for them as what helped them get through it. So sometimes it might be us, the rec therapist, if they're in a long-term placement, such as residential care, that they say, you know, that's one person that just cared about me.
Yeah, I completely agree. And I think, from my experience, it it felt like lots of the time other professions just needed to not check a box, but they had different things that they had to make sure that were happening. Whereas in recreation therapy, we can really take on a very individualized approach of what activities they like to do, and often we see those positive sides and can bring that to team meetings. Do you find that you're often sharing and advocating for your clients or patients in those team meetings on more of like a strengths approach?
Yes, that is very true. In one treatment team, the the kid's DHHR worker pretty much said, all I've heard is negative things about this kid. This whole meeting's been awful. And us in rec therapy, that's a good point, a good opportunity to point out what they are working on, such as practicing social skills, like healthy interactions with other kids through activities where, they're not trying to kill each other.
Yeah, for sure. Yeah, I think there's so many positive things that we see, and because we have that prolonged experience and um, time with them, I find that that good stuff comes up more often, and often we're a safe space to them, which is really awesome and just highlights their profession as well. I mean, every single team member is so vital and so important, but I think this can really help us, have a little bit of excitement for recreation therapy of how we do this. And for me, at the very end of my practicum, I really shared, what are some ways that all of us can, see these strengths in our clients, and what are some, perspective switches that we can have. So I'm wondering, what psychological impacts does recreation and leisure have on us? So essentially, what is the crossover and interaction between psychology and like positive emotions, like we were saying, and recreation and leisure? How do they impact one another?
I think they're so blended that they're just one of the same. Of course, with our activities, they're really great with helping people manage their emotions or develop interpersonal skills, learn to be in the moment, things like that.
Yeah, I think I agree. They're so blended that it's hard to pull them apart. Um, I find that, inherently when I'm doing an activity, lots of the time there are those like positive impacts. And those coping strategies that we do in recreation therapy transfer over to how they're feeling, which is really awesome. Um, Another thing that you had mentioned to me was your interest in CBT and DBT, otherwise known as cognitive behavioral therapy and dialectical behavioral therapy. And I'm wondering how we could use these approaches as recreation therapists.
Okay. I'll share that. Of course, I told you earlier that I love learning. I do have a master's degree in mental health counseling, and I'm a national certified counselor and a licensed professional counselor as well. I'm not saying that to brag. I consider myself humble, but I just love learning. So
Yeah.
I'll share with CBT, cognitive behavior therapy. First, it starts off with radical acceptance of accepting that we can't change other people, their thoughts, feelings, or emotions. That causes a lot of stress if we're trying to change other people. So as a rec therapist, I just accept I really can't change any of the clients or patients who I provide services for. What we teach in CBT is that you can change your thoughts, feelings, and behaviors, and they're all connected like a triangle. For example, if a person thinks, I hate my life, they're going to feel useless. They're going to act in ways that are like moping and depressed, versus if they start changing their thoughts to focusing on maybe gratitude, something they're glad about, they start feeling a little better, maybe having a bit of a pep in their step. You can think of the glass half full or half empty. It's just really changing how you look at it to be more effective at bringing about feeling better and acting better.
Yeah. I'm wondering, say if a client had brought up like a negative emotion that they're having, how can we, in a recreation therapy intervention, when we're doing an activity with them, how can we maybe flip the script and kind of encourage some of these more positive thought patterns?
I start off first by asking, hey, would you like some advice on this, before I just like give advice. So they're more
Yeah.
open and willing. So if they say yes, okay, now they're open. If they say no, then I usually don't bother them. And then I'll suggest, if the kid says something like, I'm stupid, I'm like, how does that make you feel when you think that way? Because usually when they're playing a game, they share these thoughts out loud so we can see what they're thinking or understand what they're thinking. And we can suggest healthier ways of thinking. So this really works real close with the counselor.
Very interesting. And how would you encourage DBT in recreation therapy approaches?
Okay, I'll start off with talking about dialectical behavior therapy. It was created by Marcia Linehan as a treatment for people who suffer from borderline personality disorder. And research has shown that DBT has been helpful for people with all kinds of different mental health needs. So I'm a big fan of DBT, and I think it blends in so well with rec therapy. It's best to have training in DBT and be as part of a consultation team. However, what I know from DBT is if you know the skills, you can teach the skills. So even a patient could teach the skills to their family. One of the biggest things in DBT is providing validation. It's understanding the person's real and their feelings are real. There are some assumptions that people want to do well and they're doing the best they can. And there are 4 skills in DBT, and I think it's easy to remember them by the acronym of DIME. D is for distress tolerance. It's really helping people to get through suffering without making it worse. Let's see, the I is interpersonal skills, which is teaching social skills, manners, pretty much is how I describe it. The V, oh no, the ILM is for mindfulness, being in the moment. If we think about the past, we might feel depressed because we missed the good days, or maybe we had a bad past event. And if we go to the future, we're having all kinds of anxiety and worries of what if that happens again. Versus if we're in the now, we're just kind of present right here in the moment. You look around, and in this session with you and me, I can look in your picture and see your background. It's just a calm room. Nothing's going on in the moment that's distressful. Okay, so DIM, and then the E is emotion regulation, is, how to cope with anger, sadness, depression. So those are the 4 main skills. And I think that blends in so much with rec therapy because we do so much with people skills and dealing with emotions.
Yeah, I'm really curious. While you're working in an interdisciplinary team, do you ever, work with the social worker or a psychologist to do kind of like a blended group session on things that relate to CBT or DBT?
Oh yeah, there's surely times when we've co-led groups. Sometimes the counselor or the social worker goes with the rec therapist on community outings in residential and psychiatric residential settings.
Very interesting. How have you found that of when you've mended these two together and used them in recreation therapy? How have you found that they've worked?
I think for the children, it's more just having the social support of just knowing they have people there for them.
Mm-hmm. That's awesome. Yeah, I think recreation therapists can definitely be that for them and often are a really nice listening ear for sure. So in chatting, is there any other psychology approaches that you find useful when working in recreation therapy and that we can utilize as recreation therapists?
First, I'll share that rec therapists work in settings such as with people who are geriatrics or the community or parks and recreation or behavioral health. And the interesting thing about behavioral health is it applies to all the settings. If you're working in the community, schools, prison, parks, all people have behavioral mental health needs and abilities. So I think that's important to know. Another area is the growth mindset, which it's the opposite of the fixed mindset, which is the fixed mindset is nothing I do, I can't do anything to make improvements. It is what it is. And the growth mindset is, well, with practice and determination, I can get better. a fixed mindset is I can't do this. A growth mindset is I'm not able to do this yet. So I definitely share for rec therapists to learn about the growth mindset.
Yeah, that's awesome. And I think a really good thing to think about when we're thinking about mental health and recreation therapy is that each one of us have mental health that we're either, contributing to, or, maybe not contributing to, or contributing to in a negative way. So when we think, regardless of the population, we can still think that lots of these different things and mental health and psychology in general can still apply to many of our populations, if not truly all of them.
Yeah, definitely.
Yeah. Some is there any other topics that you'd like to mention for either, continued education or for psychology and recreation therapy?
In regards to psychology, I would say being self aware as a practitioner, and all people have issues, and being aware of any triggers or any transference where or counter transference where if someone reminds you of someone that you're still treating them in a therapeutic manner.
Yeah, I think that's really important. In taking a trauma-informed care course, I think a really huge thing for me was that re-traumatization and, ensuring that as practitioners, we are contributing positively, sorry, to that therapeutic relationship, and, trying our best not to add to that re-traumatization, because some things that may trigger us may also be triggering our clients or stressing our clients, as some people like to prefer to say.
I did think of what I'd share on this. You had me thinking self-care, because we work with patients who can be very dangerous and suicidal, and we might experience vicarious trauma where their reactive behaviors or impact us from where they're hitting us or kicking or spitting, based on my experiences with the kids. So it's important to do that self-care. So the next day when you come in after the kids cussed you out, that you're still trying to build that therapeutic relationship with them.
Yeah, I think that's really huge. And I know, talking with other professionals and a social worker, it was really interesting in talking about how sometimes we take on our clients' trauma,
Yeah.
or our clients' concerns. And so, really, that self care is so important. And I know my friend often shares a really amazing mantra that she does every single day at the end of her shift, which is go to the washroom regardless of if you have to or if you don't have to, and washing your hands and just kind of washing the worries away. You did the best you can in that day, and you did make an impact, and you tried your best. And being able to go home and take those times and, be our own rec therapists and be able to recharge.
Oh, definitely. I'll definitely share that method with others, and I'll pay attribution to you, Adriana, and your website. Just
Yeah,
wash it away. I'm going to do
yeah, yeah. It was really beautiful, and at the time I hadn't thought of it. And I think sometimes we, carry those. At the end of the day, we're not always going to have 100% success every single time.
Oh, yeah.
Being able to wash away those worries and those stresses, because we can only help as much as we can. I think you shared a really amazing point before, is that we cannot fix anyone, we can't change anyone. They have to be ready for that change. So at the end of the day, we can do as much as we can, and they are still their own decision maker in that.
Yes, I definitely think we're planting seeds to help them grow if they're not doing it now. And ultimately, we're all responsible for our own health and wellness. I sometimes teach the kids, like, I'll ask them who's responsible for your dental health. And like, oh, I guess me, I have to brush my teeth. And then I'll ask who's responsible for your mental health. And like, well, my parents, or they'll say my girlfriend or boyfriend. And I'm like, actually, it's still your own responsibility. So we're teaching responsibility, really.
Yeah, I think that's so huge. And not, I know even personally, I'm working through this of, we can't let those around us be the person controlling our lives. And not that anyone is controlling my life, but sometimes, seeking outside validation is microaggression against that. And, taking that ownership back and owning that, I do have the ability to validate myself and how I'm doing, and also that I have the ability to change if that is what is best for me. Awesome. So this has been a really interesting conversation, and I've really loved how we've mend psychology and recreation therapy, because I think truly we are those applied social psychologists. And I'd really love to share and hear more so share your website of a recommendation I would share, but any recommendations that you have to continue our understanding of continued education and psychology and the crossover between all of these.
Sure. My website's rectherapytoday.com. It's a continuing education site. That's what we do. Other sites I can't think of right off, but I'd definitely join the American or the Canadian Therapeutic Recreation Association. I'm a lifetime member of the American one, so staying involved there because they provide a lot of useful resources, but not so much to take from those associations, but to provide and give back to the association. And then, of course, Googling interests such as humanistic psychology, social psychology, positive psychology, the growth mindset, and studying any of those areas.
Yeah, I think those are great recommendations. And I know there's lots of different psychology websites out there that I think of and utilize as well. I know something that I use a lot is behavioral activation as a psychology term, but really something that we can easily apply into recreation therapy because it really accesses those positive activities that we do. So if anyone wanted to connect with you, I know you shared your website, but is there any other way that they could connect with you?
Mostly just through the website. I'm on Facebook. We have Rec Therapy Today on there, and Instagram. It's instagram.com/Rec Therapy Today. So those are the biggest places. My original site, it's kind of outdated. I created the MySpace for Rec Therapists, and unfortunately it died, so we switched over to Facebook.
That's fun. Goes to show how long you've been really advocating for us. So that's awesome. Awesome. So Danny, is there any last words that you'd like to share? Anything you'd like to reinforce before we end this conversation today?
I'll share one thing. It's just being an advocate for the kids. Where I work, sometimes direct care staff or even administration over direct care staff will think and communicate that, well, the kids that are misbehaving shouldn't go to rec therapy. And I'm thinking, well, those are actually the kids who need it the most, because I'm thinking, we're helping them to develop those social skills and emotional regulation skills and leisure skills and life skills. Of course, I get it sometimes when they're rough. Sometimes I just feel like this is going to be stressful if we bring them along. So just really being an advocate for the people who we provide services for and making sure they're getting the best. And I suppose that's all I have to say.
Awesome. Yeah, that's really amazing. And I think an important thing to remind ourselves of is recreation and leisure is actually a human right as declared by UN. So really recognizing that regardless of the situation, everyone has the human right to recreation and leisure, and there is so many positive things that can come out of it. And advocating for our clients is definitely so important. So thank you so much for being on today, Danny. It was honestly such a great conversation, and I love all the content you do make, and I can't wait to see what you have in store for us. So thank you.
Thanks so much for having me. It's a pleasure, Adrienne. I'm so happy to meet you, and keep up this podcast. I'll be telling people about it.
Oh, thank you so much.